Hello. Hi. I'm Varun here, and I'm starting my PowerPoint. Wait for a while, please. Good evening to all, and my name is Varun, and I'm working as a specialty doctor in Prince Charles Hospital in UK, and this is one among interesting topic for all the international medical graduates, international medical doctors, those who want to work in NHS, and this is exclusively for the doctors, those who want to know how the NHS works and what are the responsibilities of NHS doctor, those who are new to the NHS system. And I would like to thank the participants, though there are only few participants in the Zoom. This can be accessed in YouTube channel, by run by me, and this is live in the YouTube channel as well. So coming on to the just a short talk, and I'll give you some time to discuss about few. I'll take few questions from the participants from the YouTube channel to discuss about what's the role of a doctor, those who are new to the NHS. And let me start with the first thing. First slide is, so as I said, this is the talk about NHS and also the international medical graduates or the doctors, those who are going to start the new job in NHS, and how this system, what is the difference between the system where they are working and what is the system which is uh, which is to be followed in NHS, because NHS has got it's a vast thing. NHS is vast. It's not just a small hospital, and it's a vast thing. And so first question is, I'm a consultant in a developing country. I've got this much number of experience in my field of specialty. Either it can be a surgical specialty or a medical specialty or a subspecialty. Will I be able to practice easily in NHS? I'm not saying will I be able to practice as a consultant. I'm saying, will I be able to practice easily in NHS? So the straightforward answer for this is, it's not that easy to work in NHS, though you are a consultant in uh, your country of origin or in a country where you studied your post graduation or your training. So it's not that easy, because the system is completely different, and the people, those are from developing country, will have a tough time uh, to understand what exactly the NHS is, and how exactly the NHS works. So the straightforward answer for this thing is, it's not that easy to work in a in NHS, though you are a consultant, clinically you may be sound enough to get the diagnosis, and but administrative wise and the patient management wise, in the sense not clinical management, the administrative management is completely different from the developing countries. So practicing in NHS for freshers, and this, as I said, this is exclusively for the doctors, those who are going to enter in the NHS as a new doctor, and what are the benefits of the NHS system and what are the difficulties. A few grammatical mistakes because I typed it. It's not typed. It's voice recognition. So there are few difficulties and few benefits. So any health system has got its pros and cons. So likewise, NHS has got its pros and cons, but NHS is working along side by side to come across, to overcome these difficulties. But it's never ending process. They try to analyze the thing and try to come up with some solutions, but still it is not up to the mark. So what is the main difference between the NHS and the other health system? So the Western world, especially the UK, the NHS is the health system. How it is organized is it comes under a national health system by different counties or different states. The counties can be states, it can be like the geography of the UK has to be understood first initially to know what is NHS. So NHS belongs to England, and England okay, and the UK has got four countries: England, Wales, Scotland, and Northern Ireland. So different countries under UK has different NHS names. NHS is for England, and NHS Wales is for Wales, NHS Scotland is for Scotland, and NHS Ireland is for Ireland. So people, those who want to apply for jobs, try to check different websites and different platforms to apply for different countries under UK. So UK is United Kingdom with four countries, and four countries has got different health services, national health services. NHS is for England, and NHS Wales is for Wales, NHS Scotland is for Scotland, NHS Ireland is for Ireland. So different websites are there for different countries, and you have to apply separately for NHS Scotland and NHS Ireland, and NHS England and Wales act as a single unit, and you can apply in the same website. So usually NHS Wales advertise the jobs in NHS jobs together. So the next is, what do you want to know about NHS as a new doctor? So as a new doctor in NHS, try to learn the system. As everyone says, I think most of your colleagues will say it'll be tough to learn how the system works in NHS. So for all the new doctors, those who are going to join or those who are interested to know how the NHS works, I'll give you a small glimpse of an outline how the NHS works. What is the difference between NHS and the other system? As I said, I'll just differentiate here and there how this happens in Western world when compared to the developing world. So most of the doctors, those who are entering UK, are from either from Asia or from Africa. So having been worked in Asia and Africa, I've got a broad idea how NHS differs from the other continent. Europe and Western world, America probably has got the similar working culture and also the working system, health system, and how the Asian health system and the African health system differs from the NHS. I'll let you know what all these things I'll let you know a few things about these systems now. Um, okay, what will be the level or the what will be the position you're going to join in NHS? The system is same for everyone. You can join as a standalone FY2 or FY1, or a trainee FY1 or FY2, you can join as an SHO or co-trainee 1 or 2. You can join as a registrar, specialty doctor slash consultant. Whatever will be the position you join, the health system, the national health system is same, and this national health system is same for England, Wales, Scotland and Ireland. So across the country the system is same, and the names of the system are different for different countries. However, the system is same for all whole of the UK, across UK. So how this system differs from the other system, how do the patient gets into the hospital differs in different countries, and how it happens in UK, or how it happens in England, Wales, Scotland and Ireland. So the patients enter the hospital, the patient gets admitted in the hospital just straight away walking into accident and emergency care, so we call it as A&E. So the patient can walk into A&E straight away. They will call the ambulance if there is a life threatening situation. They think that like epilepsy or fall, fracture, acute abdominal pain, and like chest pain, acute exacerbation of asthma. So whatever be the acute condition, the patient can call the ambulance, and the ambulance picks the patient from the home to the nearby tertiary center, nearby district hospital or the hospital, and from there the patient gets into the hospital. So this is one modality of entering into the hospital, the patient getting admitted in the hospital. So the patient calls the hospital, patient calls the ambulance picks the patient straight away to A&E, and the patient gets admitted in the hospital. Sometimes the patient comes to A&E straight away from home and enters the A&E and they get admitted. So the other way around is the patient gets referred by the GP, and the GP refers the patient to A&E, and the A&E doctors admit the patient into the hospital. So the A&E doesn't have the rights to admit the patient. The A&E calls over the specialty to which the to which the patient belongs to. For example, if the patient comes with acute exacerbation of asthma, the concerned specialty, the medical registrar or the respiratory registrar who is in charge of this patient comes and reviews this patient and checks whether the patient needs admission or not, and then the patient gets admitted. So if the patient is not fit for admission, the patient gets discharged either from the A&E, or they have something called as medical admission unit, where they keep the patient for 1 or 2 days and then discharge the patient. Okay, and this is how the second modality. So first is straight away the patient comes, calls the ambulance, comes to the hospital. Second is the patient is referred by GPs to the A&E, and from there the patient gets into the hospital. And the third way is the patient calls 911 and gets the advice and calls straight away, comes to A&E. And these are the few things. So this is how the patient gets into the A&E. And can a patient come to A&E without a GP referral? Yes, the patient can come in without a GP referral, provided the patient has got real acute emergency. The patient can't enter the like patient can enter the hospital A&E, but usually the patient, those who doesn't need any acute care, are not dealt that easily. They just try to manage the patient for a time being, and ask the patient to get the GP's consultation for anything which can be managed at the GP level. So the patient who needs an acute care will definitely will be taken care by A&E, and the patient who can be managed at GP level will be managed by GP. And these are the few things how the patient gets into the hospital. And the next is how the NHS differs from the developing world. So NHS, okay, 90 to 95% of the population in UK is taken care by NHS. NHS, though it's run by government organization, it's equivalent to the private hospitals in Asia and Africa, and we can say it's more than the private hospitals in Asia and Africa. So it's not just a government hospital, it's the care, it's the real care which you can which you can expect from the NHS. And everything is systematic, nothing can be bypassed, and nothing is hidden, everything is open book in NHS. And so there are private hospitals in in UK, but 90 to 95% of the population trust NHS, and there's no very less people uh, go to private hospitals for their healthcare, and 95% of the healthcare of the UK population is taken care by the NHS. So very rarely we can see this kind of government contribution to the public healthcare in other parts of the world, apart from some Western worlds like UK. So how are the patients are treated in the hospital? So like every other hospital, patients are treated medically. So the standards, everything is protocol based. So what is the difference between the other health system and the NHS health system? So each and every trust, they develop a guideline or protocol to make sure that the patients are safe. So in other words, if a patient is if a patient comes to the hospital in a particular area, so for example, if a patient is in London and the patient comes to hospital where where this hospital caters the London population, and that protocol will be followed by the doctors in that hospital. But the same doctor, if he goes to another trust, and the protocol may vary and the treatment plan may vary when the doctor goes to the other hospital. For example, it's more obvious in microbiology when we prescribe the antibiotic. So a patient who's admitted with some supposedly with some tonsillitis, one of the trust will prefer to treat the patient with amoxicillin. Some other trust, if the same patient goes to other trust, the patient may be treated with some co-amoxiclav. So these can be different in different trusts, like antibiotic. So there is a app called as Micro Guide, so which can give you a best uh, um, outline of what antibiotic a patient needs in different trusts. And all the trusts, most of the trusts are included in the Micro Guide. So Micro Guide will help you with the antibiotic prophylaxis. So likewise, the protocol differs in different hospitals, and the guidelines are same. NICE guidelines are the overall guidelines which the UK follows, but the protocol differs in different trust, and most of the doctors will try to follow and stick on to the protocol from the trust rather than the guidelines will be there, but sometimes we have to be following the protocols. So what is the follow-up care which is different from the developing world? So when a patient is getting discharged from the hospital, okay, as an FY1 or FY2, the patient has to be referred back to the GP, or the GP should know that this patient has been discharged. So most of the communication goes to the GP saying that this patient got admitted for this problem, and this patient has got discharged with this problem, and this patient needs follow up by the GP for these problems. If at all, if the patient has to be reviewed by the specialist or the consultant who's responsible for the patient, the patient may be brought back to the clinic with an appointment, not without an appointment, with an appointment, and the patient will be brought back to the clinic by the consultant who is discharging. If not, the patient can be followed up by the GP. If the patient is elderly, the patient doesn't get discharged just like that. The patient has to be discharged. Before the discharge, the patient needs to be assessed by different specialties like physiotherapist, like occupational therapist, and the rehab people. There are plenty of other discharge criterias. The nurses has to be agreed with the discharge plan. So all these things has to be discussed, and the patient's discharge is not just a discharge, it's a combined uh, plan, a combined um, decision by different people. And once the patient is discharged, the patient um, will be made sure that the patient is safe at home. So the other departments which are helpful are like physiotherapist, occupational therapist, SALT, speech and language testing, and rehab people, and palliative, nursing in charge. So all these other specialties has to agree with discharge plan before the patient is discharged. And the patient, after, as soon as the patient is discharged, there should be a copy of the letter which has to be sent to the GP, because the GP should know what's happening with that patient. So this is just a small introduction, and if there is anyone who needs, I'll be here for another 10 minutes or so. Okay, yeah, just 10 to 15 minutes. And if there's anyone uh, who needs to know what exactly you want to know about the NHS, I'm happy to give you some ideas about NHS. So you can, if anyone wants to ask anything, they can ask about what you need to know about NHS, and they can unmute themselves if they need, and they can raise some questions and answers if they want. Anyone interested to know? So can I wind off? Wanted you to summarize all the points. So yeah, um, it's a different system. NHS is a different system, and it would take some 6 months to minimum 3 to 6 months to understand how the system works. And if you're a hospital doctor, you will find some difficulty in understanding the system. And I'll let you know about if, like, how the system works in detail, part by part, in next few sessions. So altogether, as a doctor, wherever you work, in whichever specialty you work, you will be sticking on to the particular specialty. The patient comes to A&E, patient can be referred from GP or ambulance services or 911, and you'll be, if you are any doctor, you'll be having a look at all these patients, and these patients will be seen by the concerned specialty people. Either they admit the patient or discharge the patient at the A&E table, and the patient gets into that department after that. Thanks, Murtaza. Uh, I just summarized the thing which you need, and if you need anything more, happy to discuss. Happy to say you. All right. Thank you. Thanks for attending, and keep watching the channel. Sure, I'll come with some other interesting topics for discussion and for people, those who are going to join in NHS in near future. And put up your comments. We'll make some videos regarding this in future. Thank you.